I oversee all of the medical care and the clinical care at Rogers Beaver Health, which is a system. We're here in Wisconsin. We're also in many other states. Problem with stigma: stigma kills. People that need help with psychiatric disorders don't get the treatment, and if you don't get the treatment, it doesn't necessarily get better. It can get worse, and it can lead to families being wrecked. It can lead to work. Careers being wrecked, and it can actually lead to suicide, death. Stigma is anything that's out there that would possibly prevent people that need help from getting the help that they need. This stigma goes back to people's childhoods, where they're told to, not talk about that, stiff upper lip, pull yourself up, get moving forward. You don't tell people to get a stiff upper lip when they need to inject their insulin for diabetes, but that has happened with mental health for many, many years. There were times where mental illness was looked at as possession. There were times where it was looked at as other disorders. And people oftentimes are hesitant to get treatment, are hesitant to identify themselves as having these problems because they're worried that mental illness makes them less of a person, less of a man, less of a member of the family. And that feeling, which, as we've learned more about mental health and how it is illness like any other illness that we have, has become less of an issue, but that continues even today to prevent people from getting treatment because they're embarrassed by it or they think that people will judge them. I think it's important for family and friends to understand that they are the first line in order to help their loved ones get treatment or get help, any kind of help for the symptoms that they have. And they should also understand that treatment works and that we can help them get their loved one back to their normal selves.